The health profile aims to improve communication for people with learning disabilities in healthcare settings. It's about giving health professionals the key information they need to provide safe and timely care. People with learning disabilities face a number of barriers to healthcare, which unfortunately can lead to sort of premature and untimely death. This particular project aims to improve communications to ensure that people get the safe, effective care in a timely manner. USW have undertaken the research which has led to the development of a health profile which is currently being used across Wales and having an impact on the health and well-being of people with learning disabilities.
For a person with a learning disability, having a health profile makes a difference to those appointments they go to in healthcare. It means the healthcare provider will understand what reasonable adjustments that person needs to make, and ultimately that means that person will get the right care at the right time and there are no delays in their healthcare.
It's really important for people with learning disabilities that they have a document like the health profile. But it also means for healthcare workers like myself that they have an opportunity to have a document that improves equity in healthcare.
We could not have produced a product of this quality without USW's expertise in the field of supporting people with a learning disability.
The feedback we've received is that people with learning disabilities are really finding this profile helpful when they attend health appointments.
It is an incredibly important project because if we get it right at the beginning for people with a learning disability, making those reasonable adjustments so they get the right healthcare is really important.